I'm Leonie Penner, I'm a consultant obstetrician from King's College Hospital London. I'm on what's technically termed a NHS career break at the moment, and I've spent 3 months working as a volunteer for Maternity Worldwide doing obstetrics at Gimbie Hospital. In my opinion, the quality of the care that people receive in Gimbie is, in terms of people being available for them, exactly the same as they would expect in any hospital in a Western country. Sadly, we don't have the backup facilities like intensive care and perhaps the drugs and some of the treatments that they have in those hospitals, but there are certainly people here who, the minute a woman arrives, they will be seen by a skilled birth attendant who will make sure that the appropriate emergency treatment is instituted. Facilities-wise, we have a female ward which is 28 beds. It's actually shared with surgical and medical patients as well. In addition to that, we have 2 delivery beds that are very efficiently used, and we have 2 additional beds that we can use either for deliveries or for women who are about to deliver. We have a 24-hour emergency theatre service. We can do a caesarean section at any time, 24 hours a day. We are very fortunate to have a very nice little ultrasound machine. It's not state-of-the-art, it's not something for doing high-level anomaly scanning on, and it's very highly used. That was provided by Maternity Worldwide to the hospital.
Tell her what I think she should do. She should stay with somebody tonight, and she should come back so that I can make sure the baby's head is still here tomorrow.
The best memory is one who I was writing my wife saying, I think we're going to have another patient who's going to die, and watching her somehow turn the corner and survive. Again, it's some, it's some of the medicines we brought with us that don't have available here that helped. I know it made a difference.
The scariest thing about working here is the lack of blood transfusion, and that's a very difficult thing. There is no blood bank facility in the hospital here, and so if a woman needs to have a blood transfusion, what we have to do is we have to ask the relatives if they will line up, have their blood groups checked, and if we find a match, they give their blood and we then give it to the woman. Of course, that's quite a time-consuming process, and if a woman's hemorrhaging, it can be extremely touch and go whether we get the blood in time.
The first month I was here, a lady came far from this area, even she's out of West Willaga. She came in with ruptured uterus, and I remember the Danish obstetrician who was here at that time. We did it together, and I heard she cried after the surgery because everything was a mess. The ruptured uterus has happened days back, and everything is too gross. You can't differentiate the ruptured uterus from the bowels. So we tried to take our time and did what we were supposed to do, and after 2 weeks the patient walked home. She survived, and we remember at that time the midwife, the Danish midwife, giving her a flower and smiling and going home. Yeah, I won't forget that lady. There are other cases too, but this is even though she has lost her child and her uterus, she walked home alive and survived all that complication.
Di emutin adana duwetti emutin sadi sadeke sadana gaetti ani jiru dua ko emutin magina ke di balbala kana kesa magina rana fulani ani jiru di galla fi kaban jiru amina bira imbo arebo mali bo anje ani ijigo igo patera yani atin jirtu dani debeni arbi kamsa sadi sadeke sadana gale yede kulala magesan idada ko bar akan jiru idada ko kulala magesan bar
man kasi gargaran ni hospital kan
Mayena dua magotu ka echir dua magotu ka e an duma sena da men dewe mutenye dua ko kamsa kan de obar
every day the patients here are so appreciative, so enjoyable. They, you know, especially if you try to mention a word or two of their language, it usually brings a smile as you butcher a foreign tongue. And it's just very nice to see them happy and getting good care at the same time.
The things ideally that Maternity Worldwide need to keep doing are to be able to keep the Safe Birth Fund going, because one of the joys of Gimbie is that you need never ask the question when you're thinking about doing a caesarean, can you afford to pay for this? You can always do the operation and the Safe Birth Fund will help if they haven't got the money.
Ani mogga sadin tae mucaan kun mogaraatinaaf alana rakkoo tokko malee waraqaa maduutti baafadhee jaarameen jiras waan ta'eef dhaabbatuma maternity kanaan waraqaa isaan kennaniin baafadhee hospitaala dhaqeen quubna garaan mucaa godhee fudhadhee gale rakkoon tokkotu nan mudatini kana isa kanaa fi an dhaabbata maternity kana guddaan galateeffadha gama guddachuu.
I think you've seen a lot of things and heard a lot of things that tell you just how important the work the Maternity Worldwide is doing. And so please just look on the website to learn a little bit more about what we're doing, but particularly give to the charity.